By doing pranava mantra, we can able to overcome the obstacles. So that's the important message given by Patanjali, Maharishi Patanjali in the Yoga Sutra. So now we can able to do the practice of Brahma Mudra for 3 rounds. So just sit erect, close your eyes, hands in Yoga Mudra, shoulders are relaxed. Just close your eyes, focus on your breath. Slowly breathe out. Now breathe in, slowly turn your head, turn your neck, your right side as much as possible. Slowly inhale. And while you breathe out, asa. Now breathe in, slowly turn your head to your left. Breathe out. Breathe in, out, 2, 3, 4, 5, 6. Out, in. Breathe in, down. Breathe out. In. We can do one more time. Slowly breathe in. Slowly turn your head to your right side. Focus on your movement, what you're doing now. Breathe out. Slowly come back to center with asa. Breathe in, left. Breathe out. Breathe in, up, 2, 3, 4, 5, 6. Breathe out. In. Breathe in, down, 2, 3, 4, 5, 6. Out. In. For the last time, slowly breathe in. Turn your head to your right side. Just focus on your breath, the movement. Breathe out. In, left. Breathe out.
कोई टेक्निक सिखाओ
2, 3, 4, 5, 6. Out. In. Breathe in, down, 2, 3, 4, 5, 6. Breathe out. In. Just relax, focus on your breath. Slowly breathe in, and then slowly. Slowly open your eyes. Yeah. Just relax. Fine. So, how was the practice? Yeah. So, fine. So, I need to get answer from everyone. So, while doing this practice, right? So, we are turning the neck to right, left, up and down. Okay. So, what are all the psychological benefits we will get?
we won't get headache while doing anything. We won't get neck pain also. It will get relief from neck pain. We are looking at the computer or the laptop for so long, so neck will pain, headache, we'll get too much headache. So it will get relief from headache, relief from stress, depression, anxiety, and it will get removed from anger and negative thoughts.
Yeah, super, ma'am. Yeah, these are the benefits by doing the physiological benefits, right? So the psychological benefits, one thing is we are centered here, and from this center, we are turning the neck to the right side, to the almost right, and come back to center. Like that, we are turning the neck to the left, come back to center, down, come back to center. That means we are changing our perspective from the center to the next perspective, and from the other angle and come back to center. So by doing this Brahma Mudra practice, we can able to see the different perspectives. So always don't tell that what I am telling is right. So we can able to change that type of perspective by doing this Brahma Mudra practice. So we can able to understand the other's perspective also. So that is the most important thing that today the younger generation needs. Okay, so the today's younger generation always think that what they are telling is right. So that has to be changed, that what we are saying not only right, the other perspective also may be right. So those angle, if they get, the most of the problems will be solved. The stress will be reduced. Okay, so by doing this practice, we can able to enhance psychologically. So from we are the center, we can able to do the next direction. So right side, left side, up, down. So by doing this with sound, we can able to enhance the inner aspect by give space to others, so that we can understand the others' feeling. That is, we can enhance the empathy. Okay, so the empathy feeling has been enhanced. So we also know where we are, and we can know that to how much extent we can help others. So these type of psychological things can be enhanced, and the surroundings. So the ahar, vihar, other aspect, the socio spiritual development also enhanced by doing this practice. And the next practice we are going to do today is nothing but Marmanasthana Kriya. So Marmanasthana Kriya is the most important basic relaxation technique in the Gitananda tradition. And the Marmanasthana Kriya consists of 22 points relaxation. So Marmanasthana is nothing but pot by pot relaxation. So what we have done in this pot by pot relaxation, normally we will do from the toes to the head. We just focus on each and every part and say relax. Okay, so instead of, okay, now toes has to be relaxed, heels has to be relaxed, soul has to be relaxed. So we are telling like that. So it is in a other way, if you see, may relaxation be part of you. Okay, by telling this relaxation again and again, we have the inner tendency that we have to be relaxed in any situation. So normally today's environment, today's situation is whenever we are going, whenever we are moving outside, so we always get irritated by others because of the perception, what we have, because of the perception what others have. Okay, so by the gap between each individual, the misunderstanding occurs. Because of misunderstanding, the valuable time what we have in our life is get reduced. Okay, so whenever we get tense, whenever we get irritated, the what important thing we are losing is the most timeless valuable time what we have. Okay, so by irritating, by getting angry, by getting irritation, the valuable time what we have, that will be lost. Okay, so the one of the professor um, in our college, so he always say that time is money. Okay, and but the time is not only the money, it's a, yeah, Divya said that loss of energy. Yes, it's the energy we are losing. Okay, the positive energy. So in that time we can go so many positive things by getting irritation, by getting angry. So we are losing the valuable time in a unwanted way. Okay, by doing this type of relaxation technique, what we can able to see is by changing ourselves. Instead of, yeah, if someone hits us, okay, we don't want to show our cheek to them, but still we can able to understand the situation of others and we can move from them at least a one bit away. So once they are in a suitable way, in a comfortable way to speak, then we can go nearby. This will happen at the home always. So whenever my wife get angry, I always keep one step away from her. So it's not a, I also, it will be safe for both sides, and soon it will be a good situation will come. So the silence is one of the best way, and the other thing is the perception and the understanding of the relation. So the relaxation is the basic key, and the Marmanasana Kriya, we just start from the toes to the head part by part, and the sequential process of relaxation. The Marmanasana Kriya is nothing but the sequential process of relaxation. So what are the 12 parts we normally do is nothing but toes, ankles, feet, and from that lower leg, knees, upper leg, abdomen, hip, elbows, chest, neck, shoulders. From that, we can go to the forehead, the entire head area and back of the head. And finally, we can come to the Bru Madhya part. So we just concentrate on the Bru Madhya part for a few rounds of deep breathing. And we can go deep inside that region. And we just relax for 5 to 10 minutes. And then slowly come back in the way what we have processed inward. Okay. This consists of merely, if you are taking a, if you are going to do Marmanasana Kriya, then the better way is to lying down in Shavasana. So in Shavasana, our body should be relaxed completely. Then we have to focus our toe. Then from that, we can slowly move on to the head. Okay. So today we can have the theoretical aspect plus the practical aspect, just how we normally instruct for doing Marmanasana Kriya, so that we can able to sit in chair, close your eyes and focus the Kriya, and we can get at least the 70% of the result compared to Shavasana. And we use normally few techniques in Marmanasana Kriya is doing Marmanasana Kriya with Spanda and Nispanda. Spanda is nothing but tension, Nispanda is nothing but relaxation. So whenever we focus on the toes, we just get a slight tension over the toes, and while you breathe out, relax, the Nispanda occurs. So like that, by doing from the toes to the foot, toe, heels, ankles, knees, like that. So it's not just individual, separate parts. Okay, it's like the ink in the bottling paper. So if you put in the ink in a butter paper, it actually spreads. Okay, so like that, if you focus on toes, from toes it has to be spread all over the place, and slowly the relaxation enhances from the toes to the head, to the upper part of our leg. So we can start doing the Marmanasana Kriya. So just relax, calm yourself, just focus on your breath, close your eyes, just relax, slowly breathe out, just relax comfortably, sit comfortably. slowly breathe out. Now breathe in, slowly focus on your breath. First few rounds, we just do only the breathe in and breathe out. Breathe out, slowly relax. Breathe in, 2, 3, 4. Breathe out, 2, 3, 4. Breathe in, 2, 3, 4, 5, 6. Breathe out, 2, 3, 4, 5, 6. Now the last time, breathe in, 2, 3, 4, 5, 6. Breathe out, 2, 3, 4, 5, 6. Now slowly breathe in. Now just focus on your toes while you breathe in. Now breathe out, slowly relax. While you breathe out, the tension, stress in your toes has to be come out through your breathe in. Slowly focus on your toes once again. Breathe out, relax. Relax your toes completely. Breathe in. Breathe out, relax. Now breathe in, slowly focus on your foot. From the toes, the relaxation effect slowly moves till the entire foot, and then breathe out, relax. Breathe in, out, relax. Breathe in, 2, 3, 4, 5, 6. Out, slowly relax. Now breathe in, slowly focus on the ankles. Breathe out, relax. Breathe in, out, relax. Breathe in, 2, 3, 4, 5, 6. Out, 2, 3, 4, 5, 6. Now breathe in, slowly bring your focus till the knees. So from the ankles, the full area till the knee, it has to be relaxed. Breathe out, relax. Breathe in, bring your focus up to knee. Breathe out, relax. Breathe in, out, relax. Now breathe in, slowly bring your focus on your thigh, front part of your thighs, side and the back. So entire thighs, breathe out, relax. Breathe in, out, relax. Breathe in, 2, 3, 4, 5, 6. Breathe out, slowly relax. Now breathe in, slowly focus on your pelvic region. Breathe out, relax. Breathe in, out, relax. Breathe in, 2, 3, 4, 5, 6. Breathe out, 2, 3, 4, 5, 6. Now slowly breathe in, focus your lower abdomen region, your buttocks region, and the lower lumbar region. Breathe out, relax. Breathe in, breathe out, relax. Slowly breathe in, breathe out, relax. Now slowly breathe in, kindly focus on the lower back, the entire back region, and we start from the lower back region, the small curve and the entire back, and while you breathe out, slowly relax. Breathe in, 2, 3, 4, 5, 6. Breathe out, slowly relax. Superb. Now just breathe in. Now focus on the abdomen region. Your abdomen region, stomach region. Breathe out. Breathe in. Focus. Breathe out. Breathe in. Out. Now slowly breathe in. Focus on your chest region, the lungs, the chest region, entire chest region, lower, middle, and the upper part. Breathe out. Slowly relax. Breathe in. Out. Relax. Now slowly breathe in. Focus on the fingers and the palms. Breathe out. Relax. Slowly breathe in. Out. Relax. Slowly breathe in. Now bring the focus up to the ankle, to the elbow, and to the shoulders. The entire hand has to be relaxed. One more time, breathe in. Out. Relax. Breathe in. Out. Relax. Now breathe in. Slowly focus on your shoulders. Out. Relax. Breathe in. Out. Relax. Breathe in. 2, 3, 4, 5, 6. Out. 2, 3, 4, 5, 6. Now slowly bring your focus on your cheek and then out. Relax. Breathe in. Focus on your chin and your cheeks. Now the lips, lower lip and the upper lip. Out. Relax. Breathe in. Out. Relax. Slowly breathe in. Focus on your nose, nostrils, tip of your nose. Breathe out. Slowly relax. Breathe in. Slowly bring your focus on your eyes and the eyebrows. Then out. Slowly relax. Now slowly breathe in. Focus on your ears, both sides of your ears. And breathe out. Relax. Breathe in. Out. Relax. Now slowly breathe in. So bring your focus to the back of your head. While you are sleeping down, the tip of the place that will touches the ground, or while you're doing Shavasana, the place which touches the ground. Focus on the place, on the region, the back part of your head. And then while you breathe out, slowly relax. Now breathe in, slowly bring your focus on top of part of your head, the skull part. Breathe out, relax. Breathe in, out, relax. Now slowly breathe in, bring your focus on your forehead. Breathe out, relax. Breathe in, out, relax. Now breathe in, slowly bring your focus on your blue madhya region, the center point between the eyebrows, where we put our tilakam, where we put our bindu. Just focus on the point. Breathe out, relax. Blue madhya point. Slowly concentrate on that region. And breathe out, relax. Slightly move inward, slightly bring your focus inward on the region. And there the masterpiece of the all the centers, the pineal gland is there. Just focus on that region. Breathe in, slowly breathe out. On your own rhythm, take a deep inhalation and deep exhalation. Just focus on the part, focus on the region for a few more seconds and slowly go deeper and deeper. And feel that you are entering into the curve, and at the other corner of the curve, you can see a small light, the white light glittering. And then slowly you can move towards the light, towards inward. Go in, and while you are going towards the light, the darkness is slowly getting disappeared, and you are surrounded by the magnificent light. And it is not at all give any disadvantage to the eyes. It will be such a bright, but you can able to see. So just focus, just be there for a few seconds, and you are covered by a white atmosphere. It's like a thousand lights, thousand sun. If there is a thousand sun, and without any issues, you can able to see the sun with your own eyes, how the space will be. Just imagine that. Just be there and put your thoughts there for a few seconds. Still focus on your breath, slowly breathing it down. And once you are ready, slowly come back from the deep inner part of your mind. Slowly move back. The light is become slightly go away from you and slightly smaller and smaller, smaller. And now slowly bring your focus on the Bhru-Madhya region. Slowly breathe in. And while you breathe out, slowly focus on the forehead, top of your head, back part of your head, ears, eyes, and the nose, lips, cheeks, and ankles. Now bring focus on your entire head. Slowly breathe in, and then slowly breathe out. Now slowly breathe in, bring your focus on your neck. Breathe out, fill the breathe in, out, fill. Now breathe in, slowly bring your focus on your shoulders and your hands, chest, out, fill. Breathe in, breathe out, fill. Now breathe in, slowly focus on your back of your spine, entire spinal cord, entire vertebrae, the lower lumbar region, the seating area, the cortex, and the pelvic region, thighs, knees, calf muscles, ankles, foot, and the toe. Just a complete relaxation. Slowly breathe in and then breathe out. Just relax, focus on your breath. Just few rounds, slowly breathe out. Now breathe in, 2, 3, 4, 5, 6. Breathe out, 2, 3, 4, 5, 6. Breathe in, 2, 3, 4, 5, 6. Breathe out, 2, 3, 4, 5, 6. Breathe in. Breathe out. Slowly. Move your fingers, move your hands. Then slowly rub your palms nicely. Don't open your eyes. Just rub your palms. Feel the warmth by rubbing your palms. And then slowly place your palms on top of your face. Slowly take your hands off. Thank you. Slowly open your eyes. Normally by doing these practices, if you are in Shavasana, we can have a nice stretch and we can do some amount of Nishpanta Kriya and then slowly come back to sitting. And we are in sitting, so we can just straight away by rubbing the palms and coming to the day-to-day activity. So these practices are mainly given to the people who are come here for the psychiatry ward, and those who have the mainly those who have some pain from the physiotherapy sections. So those patients, those who are coming, this type of Maranastha Kriya relaxation techniques will be instructed to them, and they will feel a much relaxation here. And we have so many anecdotal evidence here. Once the people come to classes and the medications have been working for them. So this type of so many things happen here. So the effect of yoga here we are seeing with the people's feedback. So, and thank you for the wonderful opportunity. And now we can have the questions. If there is any questions, we can have a whatever possible way I can able to clear. And we have Professor Meena ma'am, Devasana ma'am, and the Dr. Sir is here. So they also helps to clear the doubts. Okay. Yes. Thank you.
Do you have any questions, the participants, before we start with the comment session?
Hello.
Yes, sir.
Yes, sir.
Good morning to one and all. So I want to just know how the practice improves the emotional thing. Emotional things are told that and also empathy will increase. So how the practice will improve the empathy?
It's by doing practices, the awareness will be enhanced. The consciousness, through consciousness and awareness, we can able to understand the other perspective and ourselves, so that it can lead to empathy. Okay.
Because most of the times the empathy is inborn. Actually, empathy is it's shaped and after that also we are just shaped due to the conditions where we are living and where we are brought up. So by practicing this thing, we empathy increase means which part of the brain got stimulated?
Professor Ingan, being a psychologist, maybe you will be able to answer this better. Do you want to answer, Dr. Parthasarathi? We will step in later.
My impression from doing this Brahma Mudra is that by changing the movement and changing your awareness, you will change your own perception and be more open to in your perception of others. And I don't think, as said, that empathy is something that you only have from your socialization or something that you inherit. It's something that we develop throughout our lives. And I think the ability to see others without judgment will increase your empathy. So in that sense, yeah, it's a question of increasing the awareness in your perception of others. That's how I would state it. So looking at the brain, maybe your limbic systems, which are the focus of your emotions, is kind of calmed down. So instead of being all tense, you will be more calmed down and more perceptive to the emotions and the state of being of others. And that is the basic for empathy.
And
Ma'am, I'm sure.
beyond
Ma'am,
the system, I think we progress. Don't get afraid because I'm in the dark. The current suddenly went away. Do I look like a booth? Sorry about this technical hitch, but it will come back again. Dayanidy, very well tried and very well answered. First of all, congratulations on that wonderful session. Ninganji, thank you so much for that input. Beyond limbic system, everything, like whatever we are focusing on is to develop the human brain, the later developed neocortex, right, which Patanjali talks about Pratipaksha Bhavanam. So attitude changing. So even gene expression nowadays can be changed. So why not empathy? Because your whole perspective, like Dayanidy was saying, awareness promotes so many other factors within. What is it that we are lacking? What is our strength? What is our weakness? You're able to analyze Swadhyaya. All these, put together, the Pratipaksha Bhavanam, you're able to completely change your perspective to the other side. So what you thought was not right is now, becoming right. So that is the main, benefit that we have found with Brahma Mudra when you are turning your neck to the other directions. Because we normally don't do this. Suddenly we realize, okay, there is something in the right also. So it is expanding your perspectives. Other than changing the perspective, it is like whatever you have in your mind is getting expanded completely. And the nada, again, the akara, ukara, e and the akara nada, all these are again adding up to the whole change that is happening. The limbic change, the HPA axis, whatever you want to call, and the whole message is being taken to the human brain. So the whole change is happening. Think about the integration aspect. With the awareness, you are able to now put everything together. What has been parts, what has been disintegrated is now becoming integrated, and you are able to see the other, like everything else. You see below, oh, there's a ground below me. You see above, yes, there is a ceiling, there is a sky, which more often we just take things for granted. We don't even look beyond what we can see in front of the eyes. So expansion of whatever your view is, that happens with this technique is what we have found. And I open the floor to Devasena Miss, if you want to add a few things.
Namaste, everyone. Very nice section. Again, every day, very, very special. And of course, you are already, as you explained, it's more opening, and like Brahma is the creating energy creator. So like as all four directions, like as we talk about the Ashtadik Palakas in our cultural, all the 8 direction governed by the each of the goddesses, God, Ashtadik Palakas. Like that, the Brahma also like creating energy. When you are doing the Brahma Mudra, it's opening, and we could see other direction also. and so that it's giving the more awareness for as you are already explained very well. Of course, in the yoga also, other practices also, when you are doing the like animal postures, we are as Swamiji says, it's a conscious evolution we are developing in the yoga, because the practices we have like animal postures and the human postures, of course, developing to the all the, I mean, the twisting postures and all sage rishis posture will be there. And of course, Lord Hanuman, Shiva, I mean, Vishnu postures also we are doing like a Trivikramandal, just gradually just like showing that thing. So when we are doing like even the Kita Kriya, like a worm, so we are understanding the worm, how much difficulty the worm have the the suffering, like I mean, it's naturally he can move, but it can go from this corner to other corner, but how much time it's taking. So like we could understand like just standing like a tree, even how much it's a one leg balance, even though when you're standing and the, I mean, both the legs, sometimes we are just losing our balance, especially when you're doing the practices like coming up on the toes and the heels. So we know how much we are just losing our balance. We couldn't able to, I mean, stand with the balance. That's what the Samasthi Asana we are, learning. Of course, yoga is the Samatvam Yoga Uchyate, as we learn from the Bhagavad Gita. So like that, we are just understanding slowly all the animal posture also, like a 3-in-1 actually. Because when you are doing the postures, we are, as Amaji says, when you are making with the sounds also, we are throwing away from the old brain. So from the very old, very strongly, the animal brain we are throwing, and we want to clear up and releasing, cleansing from ourselves, because many lifetimes, many janmas, purva janmas still very strongly in us, within us. So that we are clearing up. At the same time, we are really, getting the energy, making our system very strong. All our, the system in our thing getting strong, like animal, very strong. At the same time, clearing up the animal brain, slowly developing. As Dr. said, we had the chance to be in the human, but we have to develop to learn, improve ourselves to be the humane. That's the goal of the life, he often says. So we are really slowly developing, and of course, more reaching to the sage, because our Pondicherry is as quite often Swamiji remains the Veda Puri. So Lord Brahma also for Veda. So Veda Nayaka we call for Lord Shiva also. So Veda Puri. So of course, lot of many sages in Pondicherry. We have the many samadhis, the rishis. So slowly we are improving to the sage. So finally attain with the ultimate goal, the Jivatma with Paramatma. Slowly. So when we are in between, even though we are, hanging with the old brain, still quite often come and response, but still the practices helps us to understand the other side of even the animals, how suffering for us, because each and every pastor we are learning how much struggle they have. We could feel like even Tamil we say no kudu vittu kudu paidal. When they go in their form, then they know how difficult it is, like that to know. As our Adi Shankara also gone to the king's body to know the Grahastha learning, Grahastha period, to know about the Grahastha period, like that. Even the posters helping us to know how difficult it is. So slowly we started to think even for the animals. So quite easily we could think about for the person in front of us. I think it will help, I think, because automatically it's going to help in the yoga practice, all the practices. Thank you so much for this opportunity, and very well done, Dayanidhi, and of course every day very nice section. Thank you so much.
Thank you so much, Devasana, for that beautiful exposition. And it reminds me that, first of all, before I go ahead, I would like to welcome our Yoga Ratna, Dr. Madan Mohan sir, who's with us today online. Pleasure to have you, sir, with us. Anytime we have you with us, it's a special day. And we were just talking about you 5 minutes ago regarding Yoga Day. So you are right here. It's beautiful. Congrats, Daya, on a very nice detailed session that took the practical approach. I'm sorry I got delayed because of a meeting with the Vice Chancellor regarding Yoga Day, and I couldn't get out of it in time to be with you. Regarding the different explanations and questions, we must understand that all yoga practices are methods of culturing the human being. So we are culturing the human being physically, physiologically, psychologically, sociologically, and spiritually. Nowadays, maybe financially also culturing the human being. So the culturing process, culturing means to grow in a proper environment. For example, agriculture is to culture all the edible items. Horticulture for the plants. Sericulture, pisciculture for fish. Worm culture, vermiculture. Similarly, the culturing of the human personality multidimensionally is what yoga practices are meant to do. Our research has limited it to either saying your heart rate goes up or down, your blood pressure goes down or goes up. This part of the brain is activated, that part of the brain is activated, is only what we are touching the tip of the iceberg. So whenever there are changes, whenever we are doing practices, please realize they were not meant only for the body changes. They were made for the body, the mind, and the spirit to evolve from the animal to humane nature, as Devasena reminded us. So I just wanted us to remember this. All practices are somato-psychic techniques. They are utilizing the body, the gross level, stula sharira, to influence the sukshma sharira and karana sharira. And the benefits will come from karana to sukshma to stula. So the benefits of yoga are psychophysiological, psychosomatic, but the mechanisms are somato-psychic. So you are moving your head in Brahma Mudra. But it is not just the neck that is going to get strong. Your whole perceptive capacity, cognitive potential will be changed. So this is just, I wanted to share that. We already gone a little later. And this is something I will talk about on Saturday in my own talk. So we'll have time for me to talk about those things. But when Dayanidy said, rather than give a theoretical talk, I would like to explore some practices, I was very happy. And I go back to our team to introduce the next speaker. I believe Venkateshwaran sir is online with us, and we'll go over to him. I request Madan Mohan sir to be with us, and at the end also give some comments after Venkateshwaran sir's talk. Namaste sir, Vanakkam sir.
Vanakkam, sir.
Our next speaker is Dr. Venkateshwaran sir. A simple introduction to one of the famous speaker of the South India. SBT sir is a professor and head Department of Yoga and Community Medicine in Govt Yoga Naturopathy Medical College, Chennai. Sir has won Best Doctor Award from Government of Tamil Nadu and Dr. MGR Medical University. He is a privileged consultant for yoga to the former Honorable Governor of Tamil Nadu. He presented speeches at most all the government and non-government officials in the management, the teaching institutes, and in the medical colleges. So he presented papers, speeches at many international and national conferences. He has authored a chapter on obesity in the textbook of Clinical Naturopathy and Yoga, published by Ministry of Ayush, Government of India. He has conducted lifestyle management, stress, diet, health and management program, yoga and naturopathy program for many prestigious organizations. He presented many programs in Doordarshan, to create awareness and in other television channels and in all India radio. He is a regular writer in leading magazines and newspapers. His specialty is in obesity and he has his own consultant at Isha Life Health Solutions, holding positions in academic committees of many universities in and around Tamil Nadu, and he is a visiting faculty and guest faculty in many prestigious institutes in South India. So we are looking forward to your speech, sir. Over to you, sir, Venkateshwaran, sir. We welcome you on this FDP.
Sir, vanakkam. Sir, could you enable me to share the screen?
Sir, you can share it now, sir. Yes, sir, we can see your screen, but full screen, sir, full screen. Yes, sir, it's in full screen now. Yes, sir.
Okay, thank you, sir. Thank you so much for inviting me. I'm really very much grateful to Yogacharya Dr. Ananda Balayogi Bhavanani, sir. And my special thanks to, again, Yoga Tilagam Professor Meena Ramanathan Madam, who was constantly getting in touch with me. Also, special thanks to Yogachemmal Dr. Balaji at School of Yoga Therapy at ISCM Pondicherry, and all the staff who are involved in organizing such a wonderful FDP program. I'm very much grateful and I'm very much thankful again to Dr. Madan Mohan sir, who has joined at this session. In fact, already I lost, confidence in me. After Yogacharya sir was telling that he was welcoming Madan Mohan sir, I started to shiver a bit. Ayyo, what happened? I just want his blessings. I thought so much eminent personalities, when they are attend to such a webinar, we are nowhere. That is what we should learn, I feel, from such a stalwart. That is what, for the previous question, in fact, that is the only thing I believe as a clinician. Normally, I am not completely a research scholar. People ask me, how does it work and all? Dr. Yogacharya and Meena Ramanan Madam was telling very clearly at the beginning. Yoga, it basically changes our attitude. When attitude is changed, what else you need? Everything is going to change, isn't it? That is what the same thing is well said in a nutshell. The whole thing, what we are going to get it in the next, I think, Saturday session from Dr. Ananda Balayogi sir's session. He told very clearly that the whole, we are seeing only, the heart rate, whether goes up or, respiratory rate goes up. All these things are what we need is only physiological and academical changes. Today we tell one thing and tomorrow one. Then how yoga works? Basically, it goes and knock at somewhere else behind this, Shukshma level. That is the thing. And he has put like these, normally I say it is majority of the diseases are psychosomatic. That is what even WHO says. That is why we are not able to completely have health for all. It is not, how long one lives, how quality of life is not there. Today, how many doctors I see as a patients? Oh, in fact, I normally see, we, even including me, we don't have the patients now. Doctors themselves don't have the patients. Can we search for any tablet to, come out of such things? There is no tablet or anything. Then what could give the result for such a non-communicable diseases, the, cure or management? It's very simple. Everything is there in yoga. Only thing is we are not adhering to that, or we are not ready to accept saying that it's not scientific or it has to be proven and all. But now the whole Western world has started to accept medical yoga, that they started to understand the, where the yoga role is when integrating. So many hospitals have started to accept yoga and they started to, refer the patients to good yoga professionals. So it means now yoga is accepted worldwide. Okay, but what I say to my students normally is, it is as a duty of a medical professionals, it is our duty to care the patient, console, sympathy, empathy, whatever you say. Basically, we need to give them the pain from the relief from the pain, what they suffer. Yoga gives, if somebody started to understand what, started to practice a bit, yoga gives everything. What is stress? Stress is nothing but in our attitude. What is stress to me need not be stress to somebody else. I would have told by seeing the stalwarts present, even director sir, I thought, he's not there. Okay, some stalwarts not that there won't be any questions we feel, but someone would have been taken the other way. But these things, we should take it as a positive stress. So basically attitude. So yoga changes everything. Meena madam was telling, it goes and affects even now gene transformation people are accepting. From the level of the RNA, papers have been published. Maybe yoga for hypertension, yoga for diabetes, yoga and fasting level, or PP, or lipid management, waist circumference, individual research has been done. But if you put forth into any of the yoga practices, it is going to do good. What for anything you name, I can say. Why? It is able to change their attitude, mind level. That is what now I feel, the patients, anywhere in the world. Previously, today I am very proud to say that, once upon a time, if something is called drugless, where there is no medicine, people are not recognized. Today, let the patient be in the Western countries, the physician be in Eastern country, we are able to give relief. How? Just by yoga. When they started to practice, their mind changes. When somebody is ready to change their mind, it is done. This is what I normally talk to a obese patient who joins with me in any part of the country. If you are made up your mind, take it granted, it is done. Whatever could be the reason for me, it doesn't matter. I don't need any other, so many, therapists to be involved. What I want, only the individual, he should be ready to accept and get, into the, when he started to practice any school of yoga, please understand, any school of yoga, he automatically comes into the following the lifestyle modification. When the lifestyle is modified, what is yoga? Yoga is a lifestyle, isn't it? So basically, yoga, it can do magic. Only thing is, we should be in a position to, make the, individual to practice. So according to the individual, we should design a simple practices will do. It has an effect on physiological, not only physiological, not only psychological level. It has in all the three angles, it plays a major role. We have seen there are even a small relaxation, the previous speaker was telling. Relaxation method can even bring down, so much changes in the inner lining of the blood vessel. That is what now they are telling. The, what you call, completely inner portion of the blood vessel, quality of the blood vessel, endothelium. We don't need a statin drug for that. That too, the statin will have a side effect. 10% of the statin drug may even make you to become a diabetic. But whereas you should be relaxed every day, the quality of the blood vessel improves. When the quality of the blood vessel improves, what not? Why not diabetes, hypertension, or dyslipidemia, or heart attack? Everything can be made all right. So basically, all these diseases are so common. Particularly now they have named it as metabolic syndrome. That's all. Okay. So now somebody has even excess weight around the tummy. We should not miss for his blood sugar checkup. Number one. Number two, we should not, miss his blood pressure. Then we should take care about his lipids. So we cannot just like that. No, he is having only hypertension. He can eat sugar. This is what now people are trying to, make lose weight or focus on something the other way they are trying to do. No, it is not a holistic. It is not the correct method. I can make anybody to lose weight by giving them 3 times whatever they want to eat, some high protein diet. But that is not healthy weight loss. The quality of health goes at last, where they end up is something very serious. But whereas this yogic diet, yoga, what it has not given to us, it has given A to Z. We started to focus more on asana side, but whereas the other side of the coin we are ignoring. So that if we started to focus, the whole thing gets better. In India, the younger generation is the future of India. And today, luckily, we should appreciate both the governments. They started to introduce yoga into the schools. Today, the whole Western world, the problem is with psychiatric problems. I mean, drugs and so on. Now it is slowly coming into our side, Eastern side. But whereas once they start practicing this vaping or street drugs, everything, the school students get regularized in a good path. When they become regularized, the whole country will become so powerful and strong. So we should thank both the governments for introducing yoga into the schools officially. Even yoga, many yoga subjects have been introduced. And again, I thank SBV for introducing so many yoga courses. So automatically, the future generation is going to do wonders. There is no doubt in it. So we should be lucky to attend or hear these speeches. And I'm really thank again the ISCM of SBV for organizing such a wonderful program. So let us just go back to the syndrome X. It was actually named in 1988. Then WHO brought it only in 1998. So the first conference happened in 2003, then 2004, then 2005. There was a big quarrel. What is syndrome? Then by 2006 only they come to a conclusion. So the meaning, it is not just insulin resistance. Even today, there is no clear-cut thing we can define insulin resistance. In fact, out of 10, 3 are I can say IR, pre-diabetic we can say. So such a in the fast way, now people are getting into pre-diabetic. What could be the cause? Because basically we are under continuously under one or the other way under chronic stress everybody is going through. So that could be even the one reason. Not only the food we should blame. I blame the other side, the mind side. Syndrome X, people call it as beer belly. It's all different names they have given. So exactly what it is, people will have, the patient will have fasting. If you check the blood insulin level, it is not just 25. We should see that we maintain at least 15 or low insulin level, right? And abdominal obesity, I mean, we should take care about only the waist circumference. Don't worry about even your overweight. There is nothing wrong in overweight. One should not be obese. I mean, we should not carry excess, fat in our body. Don't worry about, even if you're overweight, carrying some good muscle mass. And blood sugar, if either fasting is high or you are known diabetic, they'll be, and they'll be having a slightly elevated even blood pressure. Even if it is more than 135, 85, we should take into consideration. Most of these, syndrome patients will have either raised triglycerides or raised LDL, but HDL, they'll have very, very low. HDL level, they'll have very low. But there are papers now has been published that by practicing, yoga. Again, I would like to highlight, don't ask me which yoga practices. You practice any yoga. Even you practice Shitali, the cooling pranayama, weight comes down. Any pranayamas. Okay. Not only pranayama, even try to stick on to a little bit of yogic diet. That plays a major role. And particularly pro-inflammatory state. CRP, people have started to check on their own annual checkup. CRP is very high. What can I do, doctor? They're asking. Is there any, nutraceuticals or any supplements that I start eating that comes back? Once you start practicing pranayama and started to relax, CRP level is going to come down. We have seen during the Corona period, a lot of people, when we started to give them a pranayama, what happened? Okay, so this nitric oxide, there's so much we can get benefit out of yoga. So what I would like to highlight in metabolic syndrome is, let us give importance to the waist circumference. An individual should not have more than 90, a male. Female, see that it is less than 80. So by taking an inch tape, check the, I have noted, I have put it in centimeter, 90 centimeter, 80 centimeter. If somebody is above 90 centimeter, that is the basic criteria. for a metabolic syndrome. Not just having diabetes, BP, and dyslipidemia, you cannot call it as metabolic syndrome. So the basic is waist circumference. Second thing, either slightly, fasting sugar is even more than 100, or they may take medicine for diabetes or even a hypertension they may have, and slightly low good cholesterol, triglycerides high. Okay, remember this triglycerides, one need not worry, because what you eat, that will reflect on the first 1 week, whatever the food we have taken. So we should be careful. Sometimes we may take it in thinking that the diet is good, but we may overindulge in too much of like mangoes or now the seasonal fruits. People consume too much of mangoes. Then they say, what is this, doctor? My thing has come down. So fruits are good, but simultaneously then if you consume more of fruit, we should take care about other corn. That's the only thing. So that's only temporary. But we should remember that one cannot continue triglycerides very high for a longer run, because 1/5 of the triglycerides is the source for the LDL. So we should have a touch that can be easily brought it down. There is nothing, difficult to bring it down. Why I'm stressing so much on this topic is, the global prevalence has crossed more than 40 now. Obesity is more than 40. So everywhere you see the clinic, either, sugar clinic or salt clinic or oil clinic. I mean, diabetes or, hypertension or, fat, cholesterol clinic. This is what now doctors board and all, internal medicine board and all, I see sugar clinic. Oh, so nice. Okay. And we started to see sleep institute, because no relaxation. We have everything, but no proper sleep. When there is no proper sleep, nothing. But yoga can, if somebody started to practice, even in yoga nidra, it will just get into. When Dayanidy was, if somebody would have followed strictly on the spot, I'm very sure 100% immediately they would have experienced relaxation. Only thing is, we'll have some, screen when somebody says our own thing. So there is idea focuses more on abdominal circumferences than insulin resistance. So take care about, don't worry about the BMI. BMI, does not show how quality you are. Today, people talk about, oh, my BMI is to more than 28. Yes, for Indians, no doubt, we should not have more than 28. But it is not applicable to everyone. So don't, individually, we should not come to a conclusion. See that you don't carry excess fat. So that is the thing. And so just by an inch tape, measure it around the waist in a proper manner, at the upper iliac bone. And just after the normal expiration, you just check it. If it is less than 90, be happy. Don't worry. Okay, we are not going to model and all. Okay, the quality of health is more important. So when patient comes, we should give importance. Whether the patient is a normal shape or hourglass shape or banana or, a pear shape and all. If somebody is an apple shape, we should, tell them, okay, we should take care about their sugar level, or because the location of the fat where we carry is more important. Whatever you carry, there are certain things which we cannot carry into the airport too, which is normally, they may have, allow in the railway train to travel, but it is not allowed. But like that, as far as health is concerned, even the body shape, we should take care. What the yoga gives you what shape you want, isn't it? Yoga is the only one which acts in 360-degree angle. Yeah, it is not. I don't think any other system which act in all the angles, isn't it? Either I may give some this supplement or that diet, or you do this or do sit in this tub and that tub. You just practice yoga. People started to ask me, doctor, can you pinpoint which asana, which exercise, what diet? Now I started to stop telling, don't ask me what exercise, you exercise now. That is what my answer is. This is what I learned from someone, one very senior professor. Why are you spending so much energy, doctor? You have been keep on telling me they will never change. So now slowly I started to tell exercise. That's enough for me. You practice. Doesn't matter. Even whatever the yoga asanas, start practicing, you'll come into the track. There is nothing, particular magic one. It has to be individualized, isn't it? So let's go ahead. And again, today the causes so much, isn't it? Very commonest one, can I tell? Even for today's, people, majority of economically better, not only economically better, educated. The problem is ignorant. My point is, when I see a school children obese, immediately I get angry on the parents, not the kid. Poor kid and power. Whom should be blamed? The parents are to be blamed, isn't it? Today the science says, they bring the child to me, to my clinic. They say, doctor, he or she is eating continuously 65 or whatever it is. They keep on, blaming the kid in front of everyone. I normally say, it's no. Let us not blame the children. We should blame ourselves. When the, during pregnancy itself, when they start eating a lot of sugary things, the taste goes through the amniotic fluid. That is what. So I started to now inquire into the patients, what did you eat during the pregnancy? That is why now we have even yoga for pregnancy. Don't we have? We have. Why not? Even during pregnancy, people say, I'm carrying, doctor, I'm pregnant. Can I do exercise? Can I do yoga? They immediately think all, all the, sarvangasana, sirasasana, only it comes to their name. If they follow a few of these yoga practices, I'm very sure they are going to have a very, not only a lovely, intelligent kid, it's going to be a normal delivery. So now people, started to give a package like painless delivery or what you call normal delivery or a healthy, whatever it is. Any of these yoga practices, when somebody practice during even the pregnancy, from the day one, it is. We have so much of, thing in yoga. So the first thing is ignorant, or when the doctor says you have a knee pain, lose weight, then they think. So again, sedentary life, no doubt today. We have been, many of us, we keep telling, I'm very busy, but most of the time I keep even sitting. So we should, started to hereafter, even I thought, if I don't know the laptop, I should start standing and giving the lecture. That is the best way. Like, working table. Yes, we should. Even in the audience, I request, if you can stand, why not? You can stand. Why not? Why should we sit for continuously from morning, 10:30 to 12:30 now? Take a break, you just stand. You'll start burning more calories without our knowledge. So whatever the exercise, whatever we should, cultivate into our lifestyle. Guruji was telling very clearly, I was so much, the word, what he has coined in culture. It has got everything. No, I don't think anyone requires any other class. Like culture, human culture. We want culturing. That yoga gives us, isn't it? So culturing, human culture. So it cultures everything. It makes the soil ready for everything. Once our soil is ready, I make my body ready. The outcome is, you can't even imagine. Thank you, sir, for giving such a, I learned today. This is what, we think that we know everything. I normally say, I know nothing. I have learned such a two wonderful point. Now hereafter, I'm going to use this word wherever I go. Sir, I'll take from you with your permission, sir. Okay, thank you. So the culture is what we need. Let us not go into which part of the brain, that part of the brain. It makes everything. Brain size increases. Yeah, what not you need, isn't it? So again, the eating habit, no doubt in it. The amount of drugs people started to themselves, they think that, drugs will do wonder. That is why we find in diabetes or hypertension or ischemic heart disease, in spite of taking the topmost physician's prescription and good quality medication, what patients think that I am under the care of so-and-so, my diabetes will come under the, no. That is why majority of the people end up in complication. Why? Basically, I don't want to be disciplined. I am not able to change my mind concept, attitude. So once you change the attitude, the lifestyle modifications becomes easier. Then the sugar level, everything comes into the very good control. The doctor will be very happy to remove the patients. We have, I'm not saying, we have many evidences where the diabetic drugs have been removed. You give me hypertension, yes, essential hypertension. That is why the word itself says essential. We don't need. It is essential because I am always angry, I am always eating too much of salt, not doing any exercise, not at all relaxed, basically, nothing else. No, he was telling, and I think Dayanidy sir was telling, when my wife gets angry, I think there is a distance maintained. So much, anger is, it kills. Stress kills. It is not stress which kills, it's our attitude which kills. And again, the culture has been changed. Alcohol, people think in modern medicine it has been allowed. I don't think anywhere it has been prescribed. Modern medicine now it says what is the limit, upper limit one can drink. It doesn't mean that you have been allowed to drink every day. No, they have not prescribed any level to drink alcohol. So let us not get into that. Then again, mind. Once if you make up your mind, what not? Majority of us are stress eaters. Whenever we are under stress, we show it on the food. So it is the mind and food is the strong relation. Mind. So I want to relax. I just want to lie down and watch some. No, you put that when you are stressed, start doing some stretching. You will feel how much you are relaxing. Just lie down and relax in a train or whatever it is. Nature has given us so much for, what you call relax. Just look at the nature. That's enough. And all these yoga practices, as Bhavana Madam was telling, we have got birds pose, animal pose, whatnot. What you like, you choose here. You have got thousands of choices. No other medicine gives us these many choices. Forget about you belong to which religion. You just get into the nature. And technology, again, I would like to highlight here. Today, people talk about technology. I agree. No doubt, without technology, we would have not, conducted this program. I agree. But the time, quality of time, we have got only limited source. So every second we are, it's going away from us. You should enjoy. It is not living. Even if you're attending this session, you should enjoy. If you're not able to concentrate, it means you are not relaxed. If you are relaxed, your mind is concentrated. The concentrated mind is a relaxed mind, isn't it? So there it is given. He was telling, it goes to from base, it goes to the dharana, concentration. Yes, we are not able to. Today, children, they lack only that. The next week, they call me for, I think, one deemed university in Chennai, for medical college. They said, we don't want protocol. What do you want? Doctor, can you teach some super brain yoga? They are so particular. I asked them, why you super brain? No, that particular one you just teach and you can leave the place. Just for 10 minutes, you teach only that. They think that if you do only that, that will improve. Then I said, okay. Then only they call me. Otherwise, they don't allow me to come in. So I said, I'll give you the capsule. I said, I'll give you even then simple tips. Yes, I said, you can, at least the faculties need not even sit down. They said, doctor, don't ask us to sit down. Last time when you came, you made us to sit down on the ground in front of the students. It was awkward position. This time I told, I will never allow you to sit down. Even if you want, you can even bring the easy chair and relax. I don't mind. Whichever way, you can attend my program. What I want is be relaxed. I'm not particular about it. That shows the quality of health, what we have. If I cannot sit for 15 minutes, if I can't keep my spine straight, let us not blame the sofa or chair or train or flight. Our seat is not good. So yoga, that strengthens the muscles. It improves the circulation to the muscles. When the muscle blood circulation is increased, when the muscles are relaxed, the usage of blood sugar is coming down, isn't it? So this all research paper which keeps on adding. So again, the particularly putting on weight around the tummy, which will penetrate into the liver and then even in pancreas. Today, fatty liver is so common. People get for the, what you call, abdominal scan. Doctor, I have a fatty liver. Immediately they want some, keelanelli or something. Though they are harmless, but you cannot carry on for a longer duration, isn't it? So by practicing any of the asanas, I don't mind. And remember, no single size which fits all. Previously, I used to have a standard diet chart. There is nothing called standard diet chart. How can it fit into everyone? Isn't it? So what you like, your like and dislike, the way you stare, your culture, your tradition, everything I take into consideration. If a North Indian comes, what should I write? If even a West Bengal, no. So according to them, when we put it, then the patient is within our grip. It's so simple. Please remember the insulin sensitivity and ethnicity, we are more prone. We should not forget. We should not compare for everything. Western people are doing Western people. I'm not a Western. I am an, Eastern. So we should accept that. And again, genetic, whatever the reason, it is possible. Now people are started to talk about reversible, isn't it? It is going to be possible without the help of the yoga. I don't think, it is possible. So the interdiscipline, obesity and diabetes, so we should not miss it. Each profiles each other. This central obesity, and insulin, each one because of this, because of that. So we should take care. And remember, please remember, if any of my students are there, I request you to, remember that BP, don't ignore. It's just a marker of a bigger problem. It shows it's a multi-organic systemic disease. Don't think it's in the heart. No. The BP origin itself, I normally say here. Yoga directly, the end result is here. So when you start practicing yoga, mind gets relaxed. When automatically it's a psychosomatic. It comes down. When everything functions efficiently, why secondary problem? And the majority of the cases, it is asymptomatic. Please remember, see that the patient is, keeping always a tight control, either a blood sugar or a blood pressure. My question is not 120/80, why not 110/70? Okay, there is nothing called, I don't think there is something called low blood pressure. Okay, so the lower the better, don't worry. Try to keep it at least in a target. We should tell the patients 110/70. People say when I practice yoga, shavasana, my pressure comes down. You practice every day, automatically all the pressure comes down from all the angles. Whatever the reason, let the pressure come from our college or from our partner or from our children. Everything, all the pressures can be easily tackled if we start practicing. So the truth is, not only the goal, how you brought the blood pressure under control. That is more important. Please remember, if you screen a society out of 800 people, 400 are, normally they suffer from hypertension, and only 200 are diagnosed. Out of 200, only 100 are, given a drug. Out of that, only 50 on right drug, only 25% stick on to that. Why I say today the number one killer, heart attack. We have seen very recently, and very big actor. They would have a dietitian and a permanent, regular, physician along with them. What could be the cause? Sudden death, in spite of, having a, trim, toned body. The problem is they forgot about the other side of the coin. Chitta, mind, they forgot, isn't it? So almost in a minute, one death is because of heart attack. Many of the deaths because of this heart attack could have been prevented easily. Preventable, how can we miss it? That is why now government is spending so much, illam dori, maruthuvam, so much medical technology advanced. We should not allow somebody to just die like this. So it's our duty again as a physician. It is our role is there to create awareness about yoga. So please remember, and the 20 out of in 20 years, in the past 20 years, the heart attack ratio has come to 4 times, it is multiplied. And out of 4, 2 death, 1 is immediate. So the best is easily preventable. And again, average blood sugar, everyone should keep it under tight control, because every 1% rise in the average blood sugar is 18% risk. Okay, why I normally say even the high blood sugar, these all things are blood vessel disorder. Wherever the blood flows, it is going to affect, isn't it? The whole blood viscosity. There are papers which is proven when they practice yoga practices even 3 to 8 months, the viscosity is coming down. So when the blood pressure viscosity comes down, what? You are going to prevent it, isn't it? See how you take into any angle, yoga, there is a relation, link. So primarily, we should take care about total lifestyle thing and calorie restriction, no doubt in it. Even if you eat a fruit, you can eat a whole fruit, no doubt in it. Not a whole jackfruit here, not a whole, mango. Yes, you can eat mango, like half a kg I allow in a lunch. Cut down that afternoon rice, enjoy Mangoes you don't get throughout season. Enjoy different day. Each day, one day Alfonso, one day Imam Pasand, one day whatever you want. But take care. Physical activity. If there is no activity, you should not eat. Remember that. If you don't walk 2000 steps, no breakfast. Another 2000, no lunch. Another 2000, no dinner. That's the basic, isn't it? So nothing else. So we should not miss for people who have some discoloration and all. Immediately we should change for thing. What I would like to is 30 minutes. If every day a child, if you cut down watching a television, the 30 minutes, let them go for a any kind of physical activity, any kind. Okay. Plus 15 minutes walk and 15 minutes, right? So basically 60 minutes, what we need. 30 minutes we should spend from our side. 30 minutes you take away from screen, small screen or digital screen. That is more than enough. People ask me, swimming is the best. People say walking is best, running is best, everything is best. You do it. If you can't do everything all little, just do yoga. It has got everything. It gives you all the exercise to all the joints here, not only to all vital organs, even to the mind, even spine flexibility. Do you need anything else? Even my home, there's a treadmill or EFX, no one does. They buy for 15, not even 15 days. Now all lungi and towel is, and they use for drying the clothes. But yoga, wherever you go, wherever you can practice in a small place, isn't it? Such a easy one, where do you get? And the reason people are not aware of, even now, many physicians not aware of the effect of yoga. Okay, still that is again another thing. Social, there are many things which is there in our country. So until much research is done, we should evaluate for all the risk factor for cardiovascular diseases. So that we should never ignore. And the advice remains to treat an individual risk factors when present, and to prescribe therapeutically lifestyle changes with management. So the conclusion, basic is healthy lifestyle. Underline this word, healthy lifestyle promotion. People were talking about empathy, emotion. Emotion is the culprit for our neck pain. Emotion is the culprit for our lower back pain. When I'm stressed, when I'm angry, my muscle is getting tightened, isn't it? So one day tightened at home, I go around with my friends, I relax, it becomes normal. But every day, if you are under stress, your muscles are continuously tightened. Then permanent pain in the neck and lower back. It is not the spine. So how to relax? Do pranayama. All this neck and lower back also can go. Prana. You cannot, how can you miss? Prana is everything. There is no movement, there is no prana. There is no life. If there is no movement, there is no life. Prana na vangra abdingra. There is something beyond this oxygen. I'm not able to explain. Maybe Guru will be able to explain what's real the prana is. Something vital, isn't it? So let us again calorie restrict. And if you have yogic diet, it has got everything. Yogic diet has got everything, it will meet out. It has got good amount of fiber, not only good amount of fiber, it has got good amount of soluble fiber. It has got good fat, whatnot. It feels taste. It has got everything yogic diet gives. Yogic diet gives the more sugar, fruits gives, isn't it? Even you want salt, you have everything yogic diet gives. So let us not forget about even yogic diet. So ETM is the main thing, like ATM. So eating matters. Not only eating matters, time matters. Time is very, very important. Then mind matters. So when you eat, mindful of eating, people say. So when we start practicing these yoga practices, automatically comes mindful eating comes. Automatically it is possible with yoga. We should think about why I should eat now. That's again very, very important. Okay. Then comes when, either at morning, lunch, dinner, again. Okay. Then again, where you eat, that also count. You can't eat wherever you want. There is a place, there only you should eat. I don't sleep in the kitchen. Then how can I eat it in the kitchen? Then I have to face that thing, isn't it? So breakfast, people ask me, Doctor, breakfast is very important. If you've done your fast, you should
think there's a bit issue. Maybe a signal issue is there. I think there's an internet issue. Just wait a few minutes. I think we should go log in again. I think there's just an internet drop there, so we'll give them a few minutes. I think so. We'll be back. Very energetic session. Lot of good inputs. Always a pleasure to listen to sir. So we just await his rejoining. For those who are in and around Pondicherry, next week on Saturday, you'll have a chance to listen to Professor Venkateshwaran in person. He'll be coming to SBV for the Yoga Day event on 16th, 17th. Yes. Yes, sir. Yes, sir. No issues. I think there was an internet issue. You are back. Yes, sir. You are back with us.
Okay.
Perfect. Perfect.
Sir, is it seen the screen?
Screen we cannot see.
1 second.
We are seeing you, but not the screen yet.
Just a minute, sir. I try to.
Yes, sir. No issues. No issues at all. Yeah. So while sir is getting the PPT shared again, just to remind you that next week, a chance to listen to him in person at Sri Balaji Vidyapeeth. So don't miss it. Yes, sir. Now the screen is done.
So, yeah. So the moderation is the, thank you. Moderation is the key factor, isn't it? Anything, let us not overdo it. People, ask me, how long should I do? Not necessary. If you do it, any kind of, activities, at least, 40 minutes for 5 days a week, it is more than enough. But in the beginning, we have to do it regularly, continuously. Once you are used to, it will become like addiction here. You people, I have seen many people who go for a walk, even if it rains, I have seen some big people, they keep going, they say, doctor, if I don't go for a walk, I feel something I'm missing. I'm not feeling that, what do you call, happy hormones, isn't it? Hormones. People today talk about, I'm having melatonin, through the pills, for serotonin, all those things. You get it without any, side effects. In a natural form, you get it when you start practicing yoga nidra. What else you need? Where do you want to go for, we don't even know really whether it works or not. And people keep cross-checking their EGFR and all. So yoga nidra gives us. So moderation is the key factor. Whatever we do in Tamil, alavukku meerinal amurdamum nanju. So whatever you eat, take care about the moderation. When it comes, the problem is controlling here. So to control here, we know we should not eat, but I am not able to, doctor. எல்லாம் தெரியுது ஆனா கஷ்டமா இருக்கே. அதுக்கு தான் இங்க டியூன் பண்ணணும். இங்க டியூன் பண்றதுக்கு தான் நீ யோகா போங்கறேன் நான். என்கிட்ட வர வேண்டாம், நீங்க எங்கனாலும் போங்க, பார்க்குக்கு போங்க, பீச்சுக்கு போங்க, எனி இன்ஸ்டிடியூட். Okay, you go to the temple, you are going to learn here. People, I think that is the way why they kept all those, sculptures and everything. It teaches everything, isn't it? So you start practicing. It is so easy to control, I mean, regulate your mind. So the problem is satisfaction. When we are eating, stop there. Try, let us not eat till the fullness. No, eat, enjoy. Even if you go once in a while to a buffet, but eat for the satisfaction. Okay, that's the again. So mind and food, there is a strong relation. So yogic diet, it has got, you name anything you ask me, I can pinpoint from the yogic diet. It has got what else you want. You want carbohydrate, you got carbohydrate. You want proteins, yes, sprouts, everything gives protein. Quality of protein. We have got different kinds of dal. Don't tell you got only essential. No, you mix, there are different kinds of sprouts, mixed sprouts. You get all types of balanced protein too, you get. And what else? You need a fat. Yes, nuts gives, yogic diet gives wonderful omega-3 fatty acids. You need not go for an expensive drug. Fat also it gives. B complex, you get instantly, you get B complex. Vitamin C. You get so much, people are talking about vitamin C in Western countries now. So we get it easily through yogic diet, like amla. If you start eating vitamin C, during Corona, all people were going for vitamin C, there was a demand. And fasting, no doubt. We do, fasting plays a major role. Every, in aspect of religion, whatever it is, fasting plays its own role is there. It is good. Okay, next time when we meet, we'll talk about it. And rice, I'm not against rice. Different kinds of rice is available. Let us not blame the rice that only, there are different kinds of rice, colorful rice. How we enjoy colorful fruits, let us enjoy different kinds of rice. Brown rice, green rice, black rice, millets, barnyard millet, whatever it is. It has got to high fiber, soluble fiber, then it will give you fullness in your stomach. There will not be any constipation. Not only that, it will take away all the excess blood from your stomach to the out. Even the absorption of cholesterol comes down because of this. So there are plenty. There are magic medical miracle. ICMR has proven with the methi seeds, isn't it? It's not only the what it has got, even the type of fiber, everything. So include. Don't forget about culture. Here also the word comes culture. So culture, tradition is very, very important. Okay, there is not, there is nothing special about it. I eat only oats, that brand, I eat only imported, steel cut oats or imported cornflakes. Not necessary to spend. Start eating what is grown in nearby your ragi. That's enough. We need not go for a really expensive thing. So these things will give you everything. You get everything what you need. Okay, so the question is complex carbohydrate, and none of the nuts have got cholesterol. So people are so much worried about cholesterol. Don't worry, cholesterols are necessary. We all know without cholesterol, there is nothing. Even cell cannot function. So there is no, body will produce cholesterol. Okay, your liver can produce cholesterol. Even if you worry, nuts does not have a direct cholesterol. Okay, it's all good fat is there in even including cashew, badam, pista, walnut, groundnut. Have little bit of, soaked nuts or even, boiled nuts or even raw nuts. Just a fistful. Again, the question is moderation. People, the moment somebody says nuts are very good, people will jump into almonds so much. Those things are not main course here. You should eat only little, but enjoy everything every day, carry everywhere, put it in a handbag, in a conference, you don't get something, it will give you double energy. It will give you good fat. It will give you satiety, whatnot. So those things, again, very, very good. As we have discussed, is the most abused anxiety drug is the food. There is a paper, isn't it? So don't forget. So again, during relaxation, we know energy metabolism, there is a change in the RNA and insulin secretion, and it improves, adipokinase, anti-inflammatory marker, it improves. That's again question. So what not? Criteria of a healthy diet is everything met in yogic diet, sattvic diet. We have got everything what is necessary for a healthy diet, we have got in yogic diet. I don't think any other diet can give you the wholesome concept of health. So, but today's lifestyle is, this is today's lifestyle particularly. So we should be careful. We should educate. It is our duty. Today's children are more brilliant than us. So take care about, drink. People ask, doctor, coffee, they've said it prevents, diabetes. It's also a herbal. Yes, anything excess, be careful. Okay, you got again those days coffee, herbal tea, sukku, malli, coffee. It's all, this coffee tea has come from Western. They brought it, they gave it free, then we become addicted and all. Okay, but have it, limit. So the moderation is the key factor. Okay, so exercise, we all know, do we need? Yes, no doubt. So we know how much, yoga is important. And the concept of disease. Okay, due to high stress, the person habituates overeating. That leads to deposition of fat in the body. And the excess fat, no doubt, related with metabolic dysfunction of your body. And it develops metabolic risk factor. So to combat, what you have to do, start practicing yoga, including take care about yogic diet. Then it is easy to remain, remain on health, but sustainable. The question is, sustaining weight, losing weight is damn easier. Don't worry, damn easy. You don't require any, specialist treatment. But even if you lose, sustaining is very, very important. So for the management, for the maintenance, yoga not only prevents, not only cures, even it does maintenance work. Okay, so the relaxative response, yes, no doubt, already we have discussed energy metabolism, mitochondrial function, insulin secretion, telomere maintenance, and reduced, the gene-linked inflammatory response at all. So it's again, and not only that, yoga, it regulates, leptin and ghrelin. Okay, so what happens is, the leptin hormone, satiety feeling, we don't allow. So when you start to practice yoga, you'll become mindful eating. When you start to eat mindful eating, leptin will say, stop, enough, there is a feeling comes. So there is an action with yoga. So let us go ahead with, let's not talk about growth hormone. Yes, there is a, response to yoga. You talk about growth hormone or ghrelin or leptin, everything, it works. Even a short-term yoga practice has a positive impact on some papers are there. There are many papers which has, has a, role on it. It shows on total cholesterol comes down, HDL slightly rises, even the triglycerides comes down. Not only that, yoga practices, particularly continuous yoga asanas practices, would reduce the circumference of the waist. And practicing sun salutation, Surya Namaskar. People talk about vitamin D. Surya Namaskar, it has a direct role. What it not has, it will give the whole body a good shape. So you name any asanas, it has got a good, role in it. And no doubt, this unneclated, ghrelin and pro-inflammatory adipokine comes down. So that is the main thing. And viscosity we have discussed. Pranayama, I normally say pranayama. According to me, people can't practice asanas, at least practice wherever you are some pranayama. It's supreme, isn't it? Once this is regulated, if you're able to sit straight, keep the spine straight and regulate this, then automatically all the pratyahara, everything comes into your control. When that comes to my control, I'll be able to concentrate, focus. When I'm able to focus, that uplifts automatically, isn't it? So these things will improve the parasympathetic and reduces the autonomic. Anger comes down, everything, okay? So even American Heart Association now, but they don't say the name of yoga, but now they have recommended breathing exercise, meditation, and muscle relaxation. It is nothing but yoga nidra. So yoga, there are papers for central obesity and even lipid profile. They have given, total cholesterol HDL ratios become better. And we should remember, don't worry about total cholesterol, even if it is 300. You try to improve your HDL to 100. So 300 by 100, the ratio is 3:1, very safe. Not just total cholesterol keeping only 100, but HDL only 10 is highly risk, isn't it? So the ratio is very, very important. The HDL will act like a vacuum cleaner. So try to have a good cholesterol more. That is why I say yogic diet. Yogic diet will try to push up your good cholesterol level. And not only that, even that the mind, there is a relation, the exercise, there is a relation with good cholesterol. There is no drug to improve good cholesterol. And oxidative stress, yes, it reduces. Yoga practices. Okay, so even a short-term yoga practices, there are certain papers which has proven it reduces even A1C, average blood sugar value comes down. And excess adiposity normally increases leptin level. So when you start practicing, what happens is it reduces fat accumulation. When the fat accumulation comes down, leptin sensitivity becomes better. So again, when you start practicing yoga, no doubt in it, this what you call oxygen disorder metabolism has become better. So that is called nitrosative stress. So let us not use even yoga. It has got a role in metabolic syndrome. So yoga intervention, improvements at physiological level, then improvement in gene expression level, as Dr. Meena was telling, Madam was telling, then physical improvement also. So in all the three angles, yoga, there is no role is there, and thus it does a lot of help in managing metabolic syndrome. So these are the many papers which related with the excess weight or fat or everything. Particularly Surya Namaskar, Ardha Katti Chakrasana, Ardha Matsyendrasana, Paschimottanasana, there are few which are mentioned. And pranayama like Surya Veda or Chandra Veda, whatever the pranayamas, particularly let us focus on relaxation, meditation. This is I would like to highlight. And I thank once again all the audience giving me this opportunity and very patiently listening for almost an hour. I know the difficulty, sitting after second session and before lunch, I know the difficulty. So I thank again, once again, one and all who have given me this chance, and my special thanks to the audience. Without audience, there is no program cannot be successful. So thank you very much, sir, and thank you, Yogachemmal Dr. Bhananda Balayogim sir, and Dr. Madan Mohan sir for for attending this program, and I thank one and all. Thank you very much.
Thank you so much, sir. Thank you for that very excellent, enlivening, energetic, invigorating presentation. And your commitment to spreading the message of a healthy lifestyle is much appreciated by all of us. I have shared a link in the chat box to sir's website and the work they are doing. If you type in his name, you will get, I don't know how many thousands of videos on YouTube where he shared for the benefit of society. I request Professor Madan Mohan sir for his comments at this time, sir. Welcome, sir.
Is it clear, hai, Ananda?
Yes, sir. Perfect, sir.
Okay. At the outset, I would congratulate Professor Venkateshwaran for sharing his extensive knowledge and with passion and commitment, which is effective. And he has raised so many points, which are very relevant. And it's very difficult to comment on all the points, but a few points I would like to comment. First is that obesity is the grandmother of all the problems. And he has emphasized waist ratio. And we know normally, mostly, even in medical books and magazines, they give importance to BMI. And BMI is a very, very poor indicator of obesity, overall distribution. Now, I just one example I'll give. Suppose you take two men, both 70 kilogram weight, same height, similar height. You can have one person with a big belly, protein, that he has also emphasized. Men have apple and women have the pear. You can have, one can have an apple, this protein belly. Other will be very athletic. And BMI same. They're absolutely different. And the waist circumference is very easy to measure. It's better indicator, one point. Other point is that what is emphasized again and again is culture, attitude. This is very, very important for all lifestyle changes. So here I would like to point one point that yoga is a precious gem of our cultural heritage, a gem of Vedic thought. See, there are Veda mantras where people do not mostly emphasize this point. It starts with the Veda. Veda says, yogi, yogi, tavastaram, vaje, vaje, hava, mah, Yajurved. Rig Veda also, first book of humanity, not of India, of whole world. First book in the world library is Ved, Rig Veda, where yoga is mentioned. And so yoga is our cultural heritage. It's culture. We have to emphasize culture, as Professor Venkateshwaran has also emphasized. And the culture we have ignored. We are not giving the culture to a young generation. We don't give them sanskar. And the attitude, the mind, how the mind attitude has to improve. Here also, there are Ved mantras, many of them are Shiva Sankalpamastu, the Yajurveda, 40th Adhyaya, 40th chapter. There are 6 mantras which end with the refrain, Tanme Mana Shiva Sankalpamastu. May my mind, may that mind, he discusses mind, various properties, qualities of the mind. Ending with this same refrain, Tanme Mana Shiva Sankalpamastu. May that mind of me, Shiva Sankalpa, Shiva is not here, destroyer, that's the Puranic. Shiva is benevolent, the noble dissolve, Sankalpa, dissolve. When you make a dissolve, then your attitude changes automatically. So resolve, and they say even at the time of yoga practice, especially when you do shavasana, relaxation, you must make a resolve. I will become a yogi. All our the rishis, they were yogis. Lord Krishna was a yogi, Lord Rama was a yogi, all of them ancestors, they were yogi. All those, the warriors in Mahabharata, they were above 40, 50, 60, and you know, this Bhishma Pitama, how old he was, how powerful they were, how active they were. They were yogis. And we must resolve to follow our culture. When culture, that's your mind is changing, that you resolve at the time of beginning of yoga, especially when you do Shavasana, I resolve to become a yogi. And that changes your attitude. That changes how you speak, how you behave, how you act. So that second color is very important. And then he has also emphasized the prana. The prana has to be there. Prano vai jeshashi. It's the superior, it's this senior, jeshashi, superior. Prana. And prana is increased by many factors, including your activity, your food, your drink, and also pranayama. Pranayama says emphasize. Pranayama must emphasize this one during yoga. So, and the ahara, good ahara. This is yoga also and Ayurveda also. Mitta ahara. Lord Krishna says in the Bhagavad Gita, Mitta aharam vinayastu yogaram bantu karit. Mitta aharam. Without that, nana rogo bhavetasya kinchit yoga nasidati. Without moderation diet. There's emphasis moderation diet. Mitta. In a diet you have got ritu ahara, according to the season. That's for Ayurveda. Mitta ahara, sattvic ahara. Sattvic ahara is very important. It's not nutrition only. It should be nutritional balance. So these so many points Professor Venkateshwaran has touched upon, and I am also enlightened. I again congratulate him for giving such a beautiful talk, and I hope, I am very sure that the participants, the listeners must have been benefited. Thank you very much again. Thank you.
Thank you so much, sir, for that elaborate and beautiful summary of the thoughts and your own amazing thoughts from the Vedas and the importance of Mitahara from the Bhagavad Gita. Venkateshwaran, sir, there is a question from Divya. Sir, what according to you are the attributes of a yogi? So she is asked about who is a yogi, what are the attributes?
Attitude. Anyone who practices yoga regularly, when somebody says yogi, he's in good attitude. There is no question of bad things in his attitude. Everything positive. Everything positive. Everything positive. There is nothing called negative that comes.
Beautiful, beautiful.
A yogi finds only the positive thing. I may find the negative things the moment I see someone, the moment I see some thing. But it comes for the yogi, only will see only the positive things from anyone or from the nature or anything. So it comes all positive and good. There is nothing. So always it's called, what do you say, positive attitude. In simple word, I can say it's a positive attitude.
Beautiful, beautiful perspective. You know, I remember, sir, similarly recently reading, positive attitude is not just being positive all the time, but seeing the positive in anything that happens. So it's not just saying everything will be positive, there will be negative also, but in the negative we see the positive. I think that is that beautiful perspective you have given.
Correct,
And we learn from everything that happens. What a beautiful, I love that perspective. Thank you so much, sir.
Thank you.
I know that there are a lot of questions and things to be done, but we are running late today. And this evening we have an event at Alliance Francaise, so the whole team has to have an early lunch and get ready to go there. I would like to thank Venkateshwaran sir for being with us and giving us his time and wisdom. Looking forward to having you with us next week. Where we also have Professor Madan Mohan in person. It's an honor to have sir with us.
Yes.
The founding energy of yoga and medicine. And another beautiful session from our own Dayanidy today, giving a perspective on the practical aspects and the mechanisms that are there. So I hand over to Balaji to complete the session for today.
Thank you, sir. Thank you, Venkateshwaran sir, for that wonderful presentation. So we request all of you to join again with us on Saturday, the 10th June, where you are going to have a wonderful presentation from our director, the Mahaguru, Yogacharya Professor Anand Balayogi Bhavanani, and his disciple Yogacharya Dayanidy from Portugal. So we request you to join on 10th June, Saturday at 10:30 a.m. So we finish today's session with the Shanti mantra. Om Loka Samasta Sukhino Bhavantu Sarve Janaha Sukhino Bhavantu. Om Shanti Shanti Shanti. Om. Nandri, Vanakkam, thank you. See you all on Saturday, 10:30 a.m.